How do brain MRI scan sequences detect lung cancer spread? Imagine a detailed map of the brain that helps doctors see tiny changes not visible to the naked. That's what brain magnetic resonance imaging scans do, especially when checking if lung cancer has spread to the brain. Lung cancer can travel through the bloodstream and settle in the brain, forming what we call metastases. Detecting these early is vital for planning effective treatment and improving outcomes. MRI, or magnetic resonance imaging, uses powerful magnetic fields and radio waves to produce high-resolution images of soft tissues like the brain. Unlike X-rays or CT scans, MRI does not involve radiation and provides detailed views of brain structures. When doctors suspect lung cancer has spread, they often order a brain MRI to look for signs of metastases. Brain MRI scans use different sequences or specific imaging techniques to highlight various tissue characteristics. T1-weighted images are good for showing the brain's anatomy and are often used to identify the location of lesions. T2-weighted images are sensitive to fluid and can reveal swelling or edema around tumors. To improve detection, contrast agents are sometimes used with T1-weighted images, creating what is called T1 contrast enhancement. These contrast agents help highlight areas where the blood-brain barrier is disrupted, which is common around metastatic tumors. FLAIR images, which suppress signals from fluids, are especially useful for spotting lesions near fluid-filled spaces like the ventricles or around the brain's surface. When a metastasis is present, it often appears as a rounded, well-defined lesion on MRI scans. These lesions tend to enhance with contrast because the tumor causes blood vessels to become leaky, allowing the contrast dye to accumulate and make the tumor stand out more clearly. The combination of different MRI sequences helps radiologists distinguish metastases from other brain abnormalities. Early detection of brain metastases is crucial because it allows for timely treatment options such as surgery, radiation therapy, or targeted medications. Identifying high-risk patients based on their clinical history and genetic factors can also guide how often they should undergo MRI scans. This personalized approach can help catch metastases before symptoms develop, potentially improving prognosis. Ongoing research aims to make MRI even better at detecting lung cancer spread. Advances include the development of artificial intelligence algorithms that can analyze images more quickly and accurately, helping radiologists identify metastases earlier. While these innovations are promising, they are still being validated and are not yet standard practice. In summary, brain MRI scan sequences are essential tools for detecting lung cancer that has spread to the brain. By using different imaging techniques, doctors can identify metastatic lesions early, which is key to managing the disease effectively. If you or someone you know has lung cancer, discussing with a healthcare professional about appropriate imaging tests can help ensure timely diagnosis and personalized care. Always remember, medical decisions should be made in consultation with qualified healthcare providers who can interpret these images in the context of each individual's health.